Hey everybody, and welcome back to my channel. In these videos, I'm going to be giving you guys some advice on applying to medical school and just giving you an overview of the medical school application process. And this is the second video in the series, and we'll be talking about extracurriculars I recommend doing during undergrad to best prepare you for applying to med schools. During this whole series, we'll be overviewing what you should be doing in undergrad, how to study for and take the MCAT, the primary and secondary applications, and interviews. Our next video will be on taking the MCAT, so be sure to check that out. And I just released a video on courses to take during undergrad, so check that one out as well. So just like the last video, I'm splitting these up into highly recommended and recommended. These are the highly recommended extracurriculars. These are the activities that I think are really important for you to do before you apply, because these are the activities that med schools are looking for and they're going to ask about in interviews for sure. There are some schools that might actually require you to have these two activities as well. So the first is shadowing. For shadowing, I recommend a goal of at least 50 hours, but of course, if you can get more hours, do it. More is always better for any of these. If you can vary the specialties and vary the location, that is ideal. That will show schools that you have a well-rounded idea of what medicine is like and that you're interested in exploring. Of course, if you're especially interested in one specialty, it's okay to skew your hours towards that one, but try to shadow in at least a few different specialties. As for when to do this, it's not a bad thing at all to shadow in high school, but I think that shadowing hours during undergrad are a lot more meaningful. I shadowed in high school and I didn't even mention it on my application. So I would say start shadowing freshman or sophomore year and keep doing it whenever you get a chance up until you apply or even afterwards. The other thing you need is clinical experience. This is anything that gets you into a clinical environment, like a hospital, a doctor's office, ambulance, anything like that. I did this through volunteering at my local hospital for a summer. I just hung out in the emergency room and helped out there. A lot of hospitals will allow volunteers. I just did this by finding the email of the volunteer coordinator of the hospital, and it was super easy from there. I really recommend this. I really love doing this, and I learned a lot. And schools love seeing this on your application because it counts as community service as well. I've also heard of people doing things like becoming a paramedic or getting a job as a scribe or something like that. These are really great as well. Or people will do long-term mission trips to other countries and help patients there. That works really well too. Whatever you do, keep in mind that more patient interaction is better. Schools are looking for people who have experience directly interacting with patients. They're going to ask about patient interactions time and time again while you're applying. I would suggest to aim for at least 100 hours of any combination of these clinical experiences. Again, more is always better, but aim for at least 100. Timeline for this is about the same as for shadowing. I would suggest starting early in undergrad and keep going through the application season if you can. I would tell you to definitely not wait until the last minute for shadowing or clinical experience, because if you do, schools will probably be suspicious and ask why you didn't explore your interest in medicine earlier. That'll become a problem in your interviews. So get these two in for sure and start early. So these next activities are my recommended activities. These will probably never be required of you for medical schools, but schools really like seeing these on your application. So it's definitely a good thing to have any or all of these, but if you don't, it's not the end of the world. So the first is community service. This should be in addition to any clinical volunteering you do, meaning that your clinical volunteering, like volunteering in a hospital, won't count towards these hours. Schools love when you have community service. It shows that you have a passion for helping others, and I found it really instrumental in my interviews to talk about why it is that I chose to do medicine. And you'll find that some schools really value community service, some a lot more than others. So again, it's a great thing to have. For this, the more the better, but 50-ish hours is a great goal. The second is research. You'll find that some schools value research a lot more than others, but overall it's always a plus to have on your resume. People do research through internships during the summer or during a gap year. Another way to do research is at your undergraduate institution during the year. What schools are looking for in your research is your involvement. The more hands-on and involved you are in important parts of the research, the better. And the longer you're involved, the better. So if you can be a part of a long research project over a year or two or more, that's way better than a summer. Because you'll have more hands-on experience, you can say that you helped design the research, things like that. That is what they're looking for, is really involved participation in the research. Some other things they like with research: if you can make a poster and present it at a conference, that's fantastic. Publications are icing on the cake. They love publications. And the higher up on the author list you are, the better. But it's not super common to have a publication, so don't stress if you don't. That definitely doesn't count you out. So on top of those two, it's great if you can get some kind of leadership position. This can be in a club or a team, as something like a president or a secretary or something like that. But leadership can be unofficial too. If you feel like you took on a leadership position in something like your employment or in your research team or in community service, even if there wasn't an official title to it, that counts too, because you can mention it when you're describing the activity on your application. I would say for those three, community service, research, and leadership, you should definitely try to have these on your application. It probably won't be required, but I would suggest having those three if you can. The others are good too, but not as important. So teaching positions are always good. Things like being a teacher's assistant, tutoring, and mentoring shows schools that you have communication and listening skills. Additionally, having a job shows that you have time management skills and responsibility, especially if you're employed while taking classes. And anything else you're interested in, like clubs, shows your interests and makes you an interesting person to talk to during your interview. Science clubs are great, but also doing other clubs shows you're well-rounded, clubs for sports or activism or anything else that makes you interesting. So a club or two or three that are diverse is ideal. So I wanted to briefly go back to MSAR, just like our last video. So again, MSAR is the Medical School Admission Requirements. This is an application you get through AAMC. This is the same place where you schedule your MCAT. So this is an application that gives you tons of information on a lot of different medical schools in the United States and in places like Puerto Rico as well. And it mostly focuses on MD schools, but there are a few DO schools in the list as well. And this, again, I highly recommend this. You do have to pay for a subscription, but I think it's really worth it, especially when you're trying to choose schools. I'll put the link in the description of the video where you can get a subscription to this if you're looking for that. So I just wanted to briefly show you an activity profile for a school. I just picked the first school on the list. It's Albany Medical College, but this is a pretty typical activity profile. So you see that most people have research, physician shadowing, and clinical community service. Those are, again, really common in applicants, and I highly recommend this. You'll see, especially research, will vary between the schools. Some schools will have closer to 100% because they really, really like research, while others will be a bit lower because they don't value it as much as another school. Community service is similar in that some schools really value it really highly and others not so much. So this is pretty typical that about 75% of applicants have community service. A few have military service, and about 50% usually have some sort of clinical paid employment. So that's anything like being a scribe or an EMT or something like that. So just so you can get an idea of a typical activity profile and what most people are doing. So again, we're looking at physician shadowing, clinical community service, and research are what most applicants are going to have. So just some general tips for you guys. Ultimately, I would say just do what you love. It doesn't have to be official. Things like writing a novel, working on a skill, reading, being a film fanatic, whatever it is, do things that you're passionate about. Don't just do things because you think it'll look good, because it's transparent. Interviewers will see right through it. If you're not interested, don't do it, because you have to be able to talk about it with passion. That's what they're looking for, because that makes you interesting and someone they want to talk to. And I know it's tempting to be involved in a million things to pack your resume, but schools would much rather see really deep involvement in a few activities than just barely participating in a dozen. They're looking for commitment to your activities. Doing something for several years consistently and for at least a few hours a week is ideal. And finally, while you're doing your activities, remember to take notes, especially when you're shadowing and doing patient interaction. Take notes on who you shadowed, their contact information, and what you did during that time. I promise you will need that later. Take notes on anyone you interacted with, anything that happens that's particularly impactful for you, because this will be so helpful when you're starting to apply and write your personal statement. You're going to need stories. Stories that can tell schools why you chose medicine, what kind of doctor you want to be. Stories about when you worked within a team, when you interacted with someone from the community or helped a patient, when you were an effective leader. Then you can look back on your notes when you're applying and remember what activities you did and have stories that you can pull for your personal statement. It will make your life a million times easier come application season, so I highly recommend doing that. Okay, so that's all for this video. Thanks so much for watching. And if you guys have any questions or suggestions for future videos, leave a comment below the video or email me at medadvice123@gmail.com. I'll do my best to get back to you as soon as possible. I really look forward to hearing from you guys because I know that this process is really complicated and I really want to help you guys through it. I know that it's hard and I want to be able to use my experience from just applying to be able to help you guys through it. So let me know if you have any questions. I also just made an Instagram. It's medadvice123, where I just post little tips, little snippets from videos, things like that. So if you're interested, follow me on there. And just a reminder that my next video is going to be on taking the MCAT. So check that out. And my last video was on courses to take during undergrad. So if you're interested in that, please check that out on my channel. And thanks again for watching, and see you next time.